Agnieszka KINSNER-OVASKAINEN, and I'm working at the European Commission's Joint Research Center. So for those of you who may not be knowledgeable about the JRC, we are a Directorate General of the Commission, but unlike most of the other directorates, we are actually working with science, so we are providing scientific and technical advice to the policy DGs, and we are supporting policies with scientific evidence. The reason why JRC is there is that our work is really independent from any economic interest, so this is how we are providing support. We have about 75% of scientists, and the JRC is one of the biggest sites of the Commission, and it's actually located in different places in Europe. So we have sites in Germany, Spain, Belgium, of course, Germany, Netherlands, and ISPRA, which is the biggest place where I'm working. It's in Italy, at close to Milano. So, first of all, I would like to mention the umbrella under which we have the European Cancer Inequality Registry. It is the Knowledge Center on Cancer. The Knowledge Center on Cancer is a flagship initiative of the Europe's Beating Cancer Plan. What? No. Oh, okay. Now, okay. Sorry. So the Knowledge Center on Cancer is a flagship initiative of the Europe's Beating Cancer Plan. It was launched in 2021. And the idea is really to put under one umbrella different elements and to foster independent and scientific alignment between the different initiatives that in the different angles of the Commission are happening to tackle cancer. So of course we have there all the activities of the of DG Santé from the EU4Health program, of the GRTD, and also the work of the GRC. Including also some other DGs working in this area. So inside the Europe's Knowledge Center on Cancer, we have different tools, and one of them is the European Cancer Information System, which is working very closely with the network, European network of cancer registries, and is collecting data on a regular basis, providing information on the burden of cancer, so mortality, incidence, prevalence, and time trends for very, very long periods. Then we have the European guidelines and quality assurance schemes, which are being developed at the moment 3 initiatives. I will talk about them a little bit later. We have also the Health Promotion and Disease Prevention Gateway, which is basically a place where you have a collection of evidence on risk factors, on how to tackle the risk factors, with evidence briefs for policymakers on these issues. And last but not least, sorry, this is not working. Okay, the European Cancer Inequalities Registry, which I wanted to present today. So this is just to give you under which umbrella this cancer inequality is located. The registry is also a flagship of the Europe's Beating Cancer Plan, and it was launched in February 2022. And really the idea is to have one tool, one place where which can help to identify trends, disparities, and inequalities between member states. And the reason here is not to point finger on who is doing wrong, but it's really to help member states, but also policymakers at EU level, to identify where there is a need for investments, when there is a more need for action, and how actually can you develop efficient and efficacious policies based on evidence and clear data. So my presentation will be very practical. I want to guide you through this tool and to show you really what you can find there, how you can search the data, and what kind of information is available. The website of the Cancer Inequalities Registry, which you should see the link below, is structured into different sections and contain different elements. Of course, on the top we have some news with highlights, topics of interest. Then we have the core, which is the data tool, and I will explain a lot about the data tool in the next slides. In addition to this, every 2 years we publish cancer country fact sheet, profiles, This is a publication that is done in collaboration with the OECD. The profiles are prepared by the OECD, and they are available for all 27 countries plus Norway and Iceland. They are available in English and also in the national language of a given country. And they discuss trends and inequalities for each of the countries. This is accompanied also with some overarching analytical reports where we have comparison of inequalities and policies across countries in a more short and compiled level. And we also have cancer inequalities fact sheets, which I will show you also at the end of the presentation, so I'm not going to discuss them here. Now let's go to the data tool, how it was developed, how it was conceived. So first of all, after a lot of discussions not only within the Commission but also with other stakeholders involving really a very range of stakeholders, patient organizations, we have came up with a roadmap, and this roadmap is also based on a quite extensive literature search of what kind of information is available, where are the possible data sources that we can use to populate the Cancer Inequality Registry. This was analyzed, and a first set of indicators was developed, which were supposed to be included in the registry, together with a roadmap of when they will be published. Very importantly, so of course we had to identify reliable data sources, but we also had to identify quality criteria. So not everything that is available goes into the ECIR. We have some quality criteria. And the criteria are as follows. So data on a given indicator, to populate a given indicator, have to be available for at least 65% of the 29 European countries, so EU 27 plus Norway and Iceland. So at least 19 countries need to have the data. The data have to be, of course, authorized for use and for reuse, and they have to be standardized within and between population groups. They have to be collected in a harmonized way with detailed quality descriptions and metadata. And of course, they have to be recent. I mean, at least representing the last 6 years for a given indicator. The roadmap was published. It's publicly available on the website, and it has now been updated to include a rollout of new indicators that we are going to include in the future. So, going into the data tool, what can you find? First of all, the tool is structured into 2 levels. The first level are the so-called inequality dimensions. Inequality dimensions, so you can look at the same indicators via different dimensions, by country, so geographical, by sex, of course, by age as well, so you can see how it is distributed in the different age groups, but also some socioeconomic, like education, income, employment, urbanization, very important. So we heard, of course, about urban and rural differences. And finally, we recently added a disability. So the different indicators which we do have are grouped a little bit according to what is also in the Europe's Beating Cancer Plan. So we have indicators for prevention, for early detection, diagnosis and treatment, quality of life. We also look at indicators for the burden of cancer and some additional environmental and specifically focused on childhood cancer. Now, I wanted to show you one by one in each group what can you find at the moment, but as I say, this list is going to be expanded. So for the cancer burden, we are receiving data mainly from the European Cancer Information System, and we have, of course, incidence, mortality, prevalence, but we also have some additional ones related to disability-adjusted life years, years of life lost, and so on. For prevention, focus is, of course, on the most important risk factors, so alcohol, smoking, diet, so fruits and vegetable consumption, physical inactivity, obesity, and we also have prevention related to the hepatitis vaccination and HPV vaccination. Now, For the early detection, at the moment it's focused on screening, and screening which is available for those population-based screening program for breast, cervical, and colorectal cancer. And finally, diagnosis and treatment, we look at the availability of different elements which are important for diagnosis and for treatment in the countries. So, for example, colonoscopy, CT scans, gamma cameras, for detection also mammography, but we look also from the treatment side at, for example, oncology trials for children, essential medicines for children, and the availability of workforce, so oncologists. For the quality of life at the moment, this is not very much populated. We have maps showing the implementation of the right to be forgotten legislation, but there is going to be more work done on this group of indicators in the future. Okay, we also look at environmental ones, which is basically air pollution, occupational carcinogens, particulate matter, so PM10 and PM2.5, residential radon, and passive smoking as an environmental factor. And finally, there is a focus on childhood cancer, as I said before. So what can you see when you enter the data tool? After you have selected your preferred set of indicators and dimension, you can display the data in different ways, depending on the indicator that you are looking at. For example, if we look at something by country, we can have a nice map, but the same data can be also displayed in a bar chart. The more data we will have and the more time points we will have, trends will become very, very interesting as well. And a comparison of different indicators can be done also in the form of a heat map. So when we see here, for example, this is a display of the daily smoking, cigarette smoking for each country, and you can see clearly in which countries this is more prominent and in which less. All the data can be printed, but also downloaded in forms of pictures, PDF files, and can be exported to CVS or Excel files for future use, whatever you need, of course, acknowledging the data source. So this is just to show you also, we can look at it by country, but we can also make it a bit more complex. And as an example here, we can look at smoking by income level. So in ECIR we have, for income we have 5 categories. There is from very low to very high income. They are divided in quintile groups of equivalized income. And you can look at this information from different angles. So you can, for example, sort by very low income, and we see where the highest daily smoking of cigarettes in which country is for those who have the lowest level of income. But also we can, for example, compare how in each country, what are the differences between the different levels of income in each country. You can see, for example, that in Italy, actually there is not much difference, is the last bar, between those who are smoking and have a very high level of income and those who have a very low level of income. So the smoking is more or less similar in all groups, while there are some countries where these differences are really high. So it's clear that there probably the low-income group may need to be addressed more. Okay, so that was for the data tool. Now, for those there are not indicators. There is information for which we cannot have data of such a high quality that it qualifies to be included in the data tool. And for some of the questions from some specific cancer-related topics, we are producing also fact sheets, which basically show the situation in Europe. Many of these fact sheets are done in collaboration with other organizations, like we have done some with IARC, some with the European Center for Disease Prevention, so ECDC. Some we have collaboration with different stakeholders here, and these are the ones that we currently have available. So there is on the socioeconomic inequalities in cancer mortality. Interesting one on the liver cancer inequalities in Europe and the role of viral hepatitis, colorectal and breast cancer screening, an overview, childhood cancer, and environmental factors. So these are quite short, like 2-3 pages documents with a lot of infographics, very catchy, and I think very easy to read, but as well informative. And for the future, we are planning to expand with new indicators. And also, we are going to publish very soon in February, in collaboration with the OECD, and this work is led by DigiSanté. We are publishing the country cancer profiles in February next year, because they are done every 2 years, and the last publication was in 2023. Interestingly also, for some areas where we actually don't have data, but we would like to have data, we also conduct studies. And one of the biggest areas is the vulnerable groups. For this, really, there is very sparse data available in the literature. And so access to cancer care in vulnerable groups is going to be addressed, is currently addressed for the disabled people. There is a large study led by DigiSanté on this. And we are starting a study also for the Roma populations and for homeless. It's going to be starting quite soon. So the idea is to, via a survey, to collect as much information as possible on access to cancer care in these groups. And there is also going to be a study on the quality of life. So maybe very quickly over this, this is the new roadmap. We are planning to include, for example, mortality by NATS. NATS are the statistical administrative, I don't know how to call it, elements. Anyway, this allows you to disaggregate the data at the sub-national level. So you can look not only at the national level, but you can also go not necessarily by region, but really at the lower granularity of data. And this is going to be very interesting. And for some of the indicators, for example, those which are linked to cancer registries, this may be possible. So we are planning to do that. We also want to look at the reimbursement and coverage of cancer medicines in the EU member states, and the implementation of tobacco policies. Very important for us is the work with the cancer registries, so the national or regional cancer registries. And we want also to display the coverage of cancer registries to give boost to this, so help, maybe via this help to create more registries in Europe, because these are really a very important and crucial source of data for us, for everybody. And now, moving out from the Cancer Inequalities Registry, I wanted just to mention very briefly in 2 slides on another initiative which is also under the umbrella of the Knowledge Center on Cancer, and this is the European Commission Initiatives on Cancer. I wanted to tell about this because it's also linking very closely to inequalities, and as you probably know, or may know, the European Council recommended for national publication-based screening programs to be implemented for the breast, colorectal, and cervical cancer. This happened already several years ago, but now in 2022 it was updated to include also a national population-based screening programs for gastric, lung, and prostate. And we at the GRC, from the Commission's side, are working to develop these guidelines, which are evidence-based and accompanied by quality assurance schemes for screening and care of. At the moment, really to address major inequalities, it's something that, it's a tool that we hope will help addressing the inequalities in care and access to care for cancer patients in Europe. And this is the European guidelines, and I wanted to say that 3 initiatives, which is the initiative on breast cancer, colorectal cancer, and cervical cancer, are already ongoing. The oldest one is the breast cancer. We have guidelines developed for this, and the quality assurance scheme is going to be rolled out very soon. It's currently under validation. And we are starting next year with a very similar initiatives on prostate, lung, and gastric cancer. So this is in a nutshell everything. So thank you very much for your attention.
Thank you very much.